Welcome to Module 17, where we'll be discussing filling outside of Nucara Pharmacy. Nucara utilizes a claim system that's called TrueRx, which bills insurance companies for clients' medications, and TrueRx is automatically set up to bill the Iowa BDAP for the cost of clients' copays when they're insured. So Nucara fills the medication, bills the insurance company using that TrueRx claim system, and then enters the client's BDAP information to act as a secondary payer so that the client has a $0 copay. This is all done with no issue at Nucara Pharmacy. However, this claim system can sometimes allow clients to fill outside of Nucara if their insurance requires it. The outside pharmacy, so let's say for example CVS, will fill the client's medication, bill their insurance, and then receive the TrueRx information to bill to Nucara. In turn, Nucara will then bill BDAP for the client's copay. I can't stress this enough that not all pharmacies will accept the TrueRx claim and billing system. You should be working with your agency's FBS and the BDAP team to get the client set up at an outside pharmacy or look for alternatives if their insurance strictly prohibits them to fill at Nucara. If your client cannot fill at Nucara, they have an insurance requirement that says they have to fill elsewhere. Here are the steps that you need to take. Step 1 is to alert the BDAP if we do not already know. We will need to know the name of the pharmacy and make sure that the pharmacy will accept our TrueRx billing. Step 2 is if they do accept TrueRx billing, you need to call the new pharmacy and set up a profile with the client to ensure that this is done. Please do not just ask the client to set it up themselves. Please call with the client to get their profile set up at the new pharmacy. So once the profile has been set up at that pharmacy, you would alert both BDAP and Nucara that this has been set up. Because from there, you would submit an insurance update / TrueRx request to BDAP and REMI. You do this by selecting ADAP Other, choosing the Insurance Update TrueRx box, and filling out the comment box with details of the need. Then you'll update the medication and pharmacy section to reflect that medications must be filled at an outside pharmacy. You'll update the insurance section. You'll fill out the insurance update and TrueRx box. You can simply copy and paste what you wrote in the comment box, and you'll submit the form to us for approval. In this example, I've provided you with just a quick look at what this could look like. So you're choosing ADAP Other, Insurance Update TrueRx box. Case manager is requesting TrueRx billing at CVS Specialty. Client is required to fill HIV meds at CVS Specialty by his insurance. Client is not able to opt out of this pharmacy requirement. The case manager assisted client in setting up a profile at CVS so the client is ready for TrueRx billing. Client has 14 days left of medications. The medication pharmacy and insurance sections have all been updated, and the client is able to fill all other meds at Nucara. This box must be selected each year that a client continues to need to fill at an outside pharmacy. So annual update time, you will be selecting the Insurance Update TrueRx box. Here, under the medication and pharmacy section, you're going to indicate the name of the pharmacy. You're going to answer no to the question, is Nucara Specialty in network with the client's insurance? And then you're going to fill out the name and the contact information of the pharmacy where they can fill, and add the name of the medication of the pharmacy that they'll be filling at that pharmacy. Again, you're going to choose the Needs TrueRx box, and in it you can just simply copy and paste what you put in the comment box, which is that the client is being required by their insurance to fill at this outside pharmacy. I also want to take this module to talk a little bit about other assistance programs. So copay cards are offered by drug companies to help with the cost of medications to clients. If a client is receiving BDAP, they are technically not eligible for a copay card unless it's an excluded med on our formulary. You sometimes might encounter a client who becomes over income for BDAP or who does not want to participate in BDAP. And if that's the case, generally you can work with Nucara or the alternative pharmacy to get the client set up with a copay card. However, I cannot stress this enough. Copay cards are becoming increasingly difficult to use long term. Some of them put a cap on how much assistance they will give you. Most insurance companies have moved towards saying if you as the patient have not personally paid the copay, then we're not going to count this towards your out-of-pocket maximum. So please be sure that you're checking with your FBS before pursuing a copay card instead of the BDAP. Similarly, there are patient assistance programs. These are also called PAPs. These are run by or in association with pharmaceutical companies, and they provide free or low-cost medications to people who meet certain eligibility requirements, kind of like the BDAP. So they would assess your federal poverty level. In addition to income requirements, they are typically limited to individuals who do not have or may not qualify for other forms of insurance or other assistance programs that provide prescription drug coverage. So most of the time, you shouldn't be accessing a PAP if you're enrolled in a state ADAP. Some company PAPs may be open to certain insured people with low incomes to help with affordability, but generally speaking, it's going to be the uninsured people. Manufacturer PAPs maintain their own eligibility criteria, electronic enrollment portals, and printable and fillable applications. Additionally, the PAPs may offer expedited verification processes and first-time fills at a retail pharmacy in support of rapid antiretroviral therapy initiation. So people living with HIV or providers on their behalf are strongly encouraged to use the toll-free numbers for relevant PAPs if expedited verification is required. Please email the BDAP and talk with your agency's FBS if you have any questions about patient assistance programs. Generally, we don't encourage enrollment into these programs because ADAP does provide such comprehensive medication coverage, but occasionally there will be a med that you may need to access a PAP for.